Welcome back to CBS Mornings. 5 years after Hurricane Maria hit Puerto Rico, the devastation caused by Hurricane Fiona this week is expected to add to the island's healthcare crisis. About half of the people living on the island depend on the public healthcare system. But local officials say federal funding gaps have led to staff shortages and long wait times for patients. 80% of Puerto Rico's seniors rely on programs like Medicare Advantage, but it's funded there far below the average national rate. Let's head back to our lead national correspondent, David Begnaud in Puerto Rico. David, what's going on with this healthcare system?
Look, my friend, I want to set up what you're about to see with this context. Puerto Ricans believe they are treated like second-class citizens when you compare the U.S. citizens in the United States. So it's not just the physical infrastructure here that is broken, mismanaged, and not given the proper funding, fair funding. It's also things like the healthcare system. This story came to us from Puerto Ricans on the island who said, we need help making this known.
If you ask all the players within the healthcare system, patients, providers, and administrators, they will all agree. Maria just showed you what was happening, but the system collapsed way before then.
Puerto Rico native Nelson Vadas Diaz is a researcher at Florida International University. Since Hurricane Maria 5 years ago, Professor Vadas Diaz has overseen studies that assess the state of healthcare on the island.
What caused the collapse?
The collapse is caused mainly by debt and the economic crisis in Puerto Rico and a historic privatization of the healthcare system there. Our research shows patients are waiting for 6 to 8 months to get an appointment with a specialist. If that's not a sign of collapse, then I don't know what is.
Dr. Edgar Domenech Fagundo is an ear, nose, and throat specialist in Ponce, on the southern part of the island. Dating back as far as 1999, he remembers seeing about 30 patients a day.
The average I see is anywhere from 50 to 60 patients a day every time I'm in the office.
Now, he's so busy new patients can't see him until March of next year. The day before we visited him, he had diagnosed a man with tongue cancer. That patient waited 3 months to see him.
The longer people wait, their diagnosis get delayed. And so things like cancer and other illnesses, you want to treat them early so that patient will have a better chance of cure.
Dr. Carlos Mellado is the island's health secretary.
I had a woman write to me and say that her father was having a stroke and they couldn't find a neurosurgeon. They couldn't find one. And that's why people are also leaving the island.
I have 17 neurosurgeons.
So if you have 17 neurosurgeons, and how many people live here?
3.2 billion.
Hey Siri, what's 3.2 million divided by 17?
3,200,000 divided by 17 is approximately 188,235.29.
So you have one neurosurgeon for every 188,000 people.
Yeah.
That's scary.
It is.
Nicole Damiani's 25-year-old husband, Carlos Rivera, was hospitalized about 2.5 weeks ago.
What happened to Carlos?
So he sat up on his bed and he fell onto the floor and he was having a seizure. And so I rushed him to the hospital and there was something on his CT scan.
How many days before you saw a neurosurgeon?
8.
8 days. Did they tell you why?
Well, the doctors are overworked. There are many, many cases, patients, people that need help. So the fact that there's, a limited amount of practitioners, certified practitioners, available to attend the masses is pretty alarming.
He had bleeding and swelling on his brain. He spoke to us from his hospital bed in Caguas, Puerto Rico.
It's really hard to find a neurosurgeon here in Puerto Rico. And it got to a point where I really low-key gave up on life. And it got really frustrated to a point.
Now, one of the reasons patients like Carlos have such a hard time getting medical care is that many Puerto Rican doctors are moving to Florida because the pay is significantly better. For instance, the average yearly salary for a family physician in Florida is $221,000. In Puerto Rico, they make less than $100,000. Jorge Mata runs Centro Medico. It's a complex of hospitals in San Juan. He took us to the ICU to witness the impact of low wages.
This is one of the empty rooms that, if we were to have nurses, it would be used. As you see, it's completely ready.
15 ICU beds, 8 of them are empty because they don't have the nurses to work them.
Gayle Malayas has been a registered nurse at Centro Medico for 19 years. She rides her son's bicycle to work. She says her pay is so low she can't afford a car.
Every 15 days, you were telling me your check is how much?
$891 is like a 25 cents or something like that.
That's not enough to live on for you.
No, that's not enough. I need to move to Puerto Rico. I have to learn more English because I have 2 masters.
You have 2 masters?
Yeah.
Wow. And you're making less than $900 every 15 days.
Yeah. I love my job. I love my country. But I don't see in this country. I'm very sad for that. Very, very sad. Because my mom needs me. And my son needs me.
These young men and women are the future doctors from Puerto Rico, and they showed up as a group to let us know how gravely concerned they are about the state of healthcare on the island. Carlo Bocas is a second-year medical student at the University of Puerto Rico.
We look at the conditions around us, the things that doctors tell us, our own professors, family members that may be in medicine. We hear constantly about the problems that are facing the island, and just within 3 years, we might have to make that fateful decision where we either stay or we leave, and it's not entirely under our control.
Show of hands, who wants to stay and work here? Put your hand down if you think you might have to leave. Wow.
50-50 chance, you know?
Wow.
It's not up to us.
Boy, David, I see why they reached out to you. That's certainly a story that needs to be told. And now that we're also down and know the facts, what's the solution here?
Well, so I'm glad you asked that question. The governor is saying what we need is more federal funding to come on a consistent basis. But he said, David, it's not like we want to sound like we're asking for more than somebody else gets. We just want the same that other people get. We want fairness. He said, even if you compare us to the poorest state in the United States, Mississippi, they get so much more than we do because Puerto Rico is a territory. And that circles back to where I started. That is why Puerto Ricans will say we are treated like second-class citizens.
David, thank you so much. Eye-opening, really puts things in perspective, that's for sure.